You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is a board-certified plastic surgeon that we've never had on the program before. We've invited him on the program today to discuss the latest techniques used today to create a natural-looking facelift. If you are looking for a surgeon that is a board-certified plastic surgeon, or you are thinking about doing something to give you a more youthful look, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching the Wellness Hour, the most watched medical television program in the world. I'm Randy Alvarez. My first guest is Dr. Bruce Landon. Dr. Landon is a board-certified plastic surgeon. He has joined the team at the Cosmetic Surgery Institute in Palm Desert. We've invited Dr. Landon on the program today to discuss what you need to know if you are considering a facelift. Dr. Landon, welcome to the program.
Thank you very much for having me, Randy.
Okay, now you had a busy practice in Florida. What brings you to the desert?
Well, I was born and raised in California, Randy. Did medical school at UCLA, then did all of my surgical training in San Diego, and decided to relocate out to Florida. Been there for 12 years, and I'm ready to come back. You know, born and raised in Southern California. I think you can take the boy out of Southern California, but you can't take Southern California out of the boy.
Now, before we get into today's topic, CSI. A lot of people know it in this valley. It's Dr. Ball's office. Mo Zachary now acquired the practice, board-certified plastic surgeon. Tell me about your first impression there.
You know, wonderful facility. I spent a lot of time, Randy, looking at a variety of practices in LA, Orange County, San Diego. Was privileged enough to be able to be asked for an interview here in the desert. Mo Zachary, wonderful man. Craig Ball, superb physician. Really just an honor to be asked to be a part of that facility.
Good. You know, it's funny, on the telephone you called me. I think you were in Florida at the time. You said, tell me about these guys. I met them. You know, are they as nice as they appear? And I said, that they are. Yeah. These are good guys, and I've been hiking with Dr. Zachary and out to dinner and things like that, and I think he's a good guy, and I've seen his work. Great work.
They're a phenomenal group. They have a very cohesive office, Randy, and you know what? It's not difficult for people to pull the wool over your eyes. You walk into that office, everybody seems to work well together. Dr. Zachary was wonderfully receptive to my coming out and interviewing with the practice. It's been a great experience so far.
Now, what is your role going to be there? I know Dr. Ball, like, he didn't do breast augmentation or tummy tuck, things like that. What about you?
You know, I think, Randy, in their search for a new associate in the practice, they were looking for somebody to bring, you know, a comprehensive plastic surgical practice to the facility. And my practice in Florida was everything from facelifts to breast augmentations to body contouring. And so what I hope to bring to CSI is a very comprehensive surgical practice, something that will complement what Dr. Zachary's currently doing, provide the full breadth of breast enhancement, reductive surgery, body contouring. That's what I hope to bring.
Okay, the face. We're talking about facelifting today, and I interview a lot of doctors. You know, we air nationwide. Tell me about your approach. When you look at the aging face on a consult, what are you looking for?
Well, there's really three things, Randy, that really have to be addressed with the aging face. It's quality of skin, it's volume change in the face, and it's suspension-related issues. And those issues all need to be addressed by...
What does that mean, suspension? I guess the sagging...
Well, it's the sagging. It's the sagging in the neck, the formation of jowls, the deepening of these nasolabial lines. I mean, and these are addressed in an entirely different management style than one addresses quality of skin or volume issues.
What's new that you think... What's helped the aging face the most in the last 15 years? Any new techniques?
Well, I think people's understanding about the advantages of a good skincare program has been a big boom to us, getting to people at a younger age, getting them to be a little bit more proactive about their health and their skincare in particular. That sets the stage, Randy, for when they get to the point where they need something a little bit more aggressive. That face is more well prepared. They're apt to get a better result with that more well prepared face.
Okay, now tell me about your training when it comes to lasers or IPL, things like that. Have you been using those for a while?
Yeah, my practice in Florida, we offered a full comprehensive level of laser care. We have everything from IPL in my existing spa to the non-ablative lasers like Fraxel, Thermage, and Titan, which would be the non-ablative lasers currently on the market. And we do a lot of erbium resurfacing.
What do people want to know on a consult with you? What are the frequently asked questions about the facelift? Do they come in pretty educated? They self-diagnose, this is what I need, doctor?
What they want to know, Randy, is they want you to help them sort out fact from fiction. They want to know, what does Botox do? What do the fillers do? what does a facelift involve? Is a facelift going to help my brow and my eyes, the sagging skin of the upper lids, the little bit of aging and extra skin of the lower lids? Or are these separate procedures? Are they combined procedures? And even taking it yet a step further, they want to know a lot about the aftercare. They want to know, well, how long am I not going to be able to work? How long am I not going to be able to drive? How long can I be away from my computer screen?
I always say that I could spot a facelift, 20 yards away. Dr. Ball, Dr. Zachary, when they said that they wanted you on my show, one of the things they said, you've got to look at his work. The guy is great. And your work it doesn't look pulled or tight or things like that. But isn't that part of the healing process? I mean, is there a bit of a gamble where you never know how it's going to come out, or is it more in the hands of the surgeon?
I think a lot of it's in the hand of the surgeon. I think that we have to do a great job of educating our patients about what they're going to expect after surgery, Randy. Everybody has a little bit of the pulled look. Everybody has a little bit of the unnatural appearance in those early throes after surgery. What we have to do is do a very effective job at hand-holding them through that early period, telling them that things are designed to soften, things are designed to get back to looking normal again. And it's that very early critical time when people say, oh my God, you told me I wasn't going to get the windblown look and here I have it. But we have to just see them through that critical period, because we design these surgical procedures to anticipate the normal relaxation properties of the skin, the normal relaxation properties of the soft tissue. If we don't overshoot the mark a little bit, then 5 weeks to 5 months after that surgery, then things may have fallen to a level that we and the patients no longer find acceptable. Okay,
what should a patient look for in a surgeon that's going to do a facelift, in your view? And what questions should they ask the surgeon?
I think that the basic questions that everybody should ask is, what's your level of training? Board certification is important to the patient, and I think that there's been a lot of good press on the part of the American Society of Plastic Surgery to push people's understanding of what board certification means. And it means that we that are board certified have at least sat in a peer-reviewed capacity and been tested on our knowledge base and passed from people that are considered to be experts in the field. So at least patients can come into that office with the knowledge that they are going to see somebody who has been peer-reviewed, who should be able to offer every gamut of plastic surgical improvement as a core part of our training.
But I've seen board-certified plastic surgeons, maybe not in this town, but we have people flying in from all over the country.
Sure.
Board-certified, not great work.
Yeah. I don't think that board certification and the quality of one's work are naturally go hand in hand.
Dr. Ball wasn't board certified. Great work.
Superb work. I think that the other part of the coin that people need to do is they need to do their homework.
Yeah.
I'm a big advocate of prospective patients talking to previous clients. Look, if they can get that kind of what they're searching for, Randy, is they're searching for somebody to corroborate that they've come to the right office, that they're going to get the result that they want, and who better to talk to than talking to patients that have had the procedures that they're looking at.
So you let that
absolutely.
happen.
I'm a big advocate of it. Before and after pictures, I think, are an integral part of completing one's initial consultation.
Moving on to the aging face, today's topic. What's new in facelifting? The brows. What do you do for the brows?
Brow surgery's seen a huge evolution over the last few years, Randy. I mean, we've gone from having very considerably large, open, aggressive procedures with an incision going from one ear across the top of the head to the other, peeling down the brow, pulling things back, removing the excess skin, to endoscopic procedures.
Are you doing endoscopic?
We're doing a lot of endoscopic procedures. As a matter of fact, from a preference standpoint, there's very few people that aren't good candidates for an endoscopic procedure. And we've even taken it a step further. We now have the ability with some of these new dissolvable fixation devices to do brow lifting through the upper eyelid. That mitigates the need to go anywhere into the hair area, into the hair-bearing area to be protected.
A good brow lift, though, is not one that's high.
Is not one that's high.
Because young people don't have high eyebrows.
No, as a matter, if you take any magazine, and I tell my patients do this all the time, go and pick up Vogue in Barnes & Noble or at any of the local bookstores, and you look at most of the supermodels, you'll see brows in every conceivable position. Just because a brow is not in a high position doesn't mean it's not youthful. But what happens that's a little bit different from the aging face compared to a model that's 20 years old is that we get a lot of redundancy of the upper eyelid skin in conjunction with that brow dropping in position.
On the outside.
On the outside aspect. So what we're trying to do in our rejuvenation process is to conservatively remove some of that excess upper eyelid skin. In the female population, the goal here is their ability to wear an eyeliner and eyeshadow and be able to have some visualization in a front repose position and see that their ability to have that eyeliner show. We're not looking to make the whole eyelid a visual entity. That's not appropriate. It's not rejuvenating in any capacity. If we do such an aggressive blepharoplasty and an aggressive enough brow lift that we're looking at the entire upper eyelid,
I see that all the time.
It gives people a very sinister look, and it actually ages the area
skeletal
around the eye. It's a skeletal look. It's a hollowed out look. So we're all about more conservative management of the fat compartments of the upper eyelid. We're more about...
When you call it management of the... Or you're talking about surgical management?
Surgical management.
Okay.
Yeah. The only way for us to volumetrically change the dynamics of the upper eyelid are to make these open incisions and address the fat compartments. And it's our job, and it's a job of any good surgeon, to leave what you need to leave that more natural look. And that's where you draw the line between somebody who does a good job and maybe not such a great job. You know, are you getting too hollowed out a result? And that's what's incumbent upon us, is to go back and look at our results. Hey, are we taking too much? Are we taking more than we think we're taking?
Okay. If there's a mistake nationally, and I don't want to spend too much time here, in the world of plastic surgery, that maybe you see because you have an eye for it, that's going on, if there's a mistake in how they're approaching the facelift or some of these minimally invasive procedures, what is it?
I think you can't address every aspect of the aging face with the only one thing that you might have in your arsenal. It's got to be a comprehensive approach, Randy. We've got to deal with the skin, we've got to deal with the volume, we've got to deal with, it always goes back to those three components and the suspensory issues.
And what are those three components again? And we're going to take a quick break.
It's aging skin, volume changes, and suspension issues.
Which is a sagging?
Which is the sagging of the skin, the looseness in the neck, and the looseness in the jowl area.
Okay, great. We're going to take a quick break, and we're going to come back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Landon, the new plastic surgeon in town, board-certified plastic surgeon. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We are here with the desert's newest board-certified plastic surgeon. He just joined the team at the Cosmetic Surgery Institute in Palm Desert, Dr. Landon.
Thank you.
We're talking about the aging face, the brows. So moving down, what about bags under the eyes?
Yeah, so the next thing that we look at in coming down the face, Randy, is the lower lid complex. And the triad of aging of the lower lids is the beginnings of looseness of the skin, bulging of the fat compartments, and as a consequence of that bulging of the fat compartment, the trough that begins to form in the low part of the eye area here. And addressing those three issues is what our goal is in rejuvenating that lower eyelid complex.
So where do you stand? Is it fillers? Is it adding an implant? I hear that sometimes. I'm more confused than ever, by the way, of what to do.
You know, and being a consumer of plastic surgery nowadays just lends itself to confusion because there's so much stuff written in magazines and in print and even in the media. A popular way for patients nowadays to gain a little bit of time before some of the more aggressive surgical procedures is replacing volume to the lower eyes.
Okay.
Most notably, when you start to develop a little bit of that bulging of the fat compartment, you start to develop a little bit of that troughing, we've got some very nice synthetic fillers that can fill that area, blunt that transition between the bulging of the fat compartment, the hollow along the bony orbital rim, and fillers have a very nice role to play in a well-picked patient.
What are you trying to do, by the way, when you look at the aging face? You want them to look younger? You want them to look refreshed? And what do they want? What do they say that they want?
They want to turn back the clock.
They just want to look younger, for the most part.
People don't want to look any different, Randy. What they'd like to do, 9 out of 10 people will usually bring some photograph of them a dozen years ago and say, look how much better I looked. I look in the mirror now, I see a slightly different person. Can you give me that look back again that I'm showing you right now?
And what do you say to that?
I say you absolutely can, and this is how we're going to approach it.
And by the way, with your facelift, and I've seen a few of yours on the website, excellent work, Is it more pulling? Is it more repositioning?
Yeah. It's repositioning. I think that one of the things that's changed hugely in facelift surgery, Randy, is paying critical attention to not only where you're moving things, but how you're moving things. You know, some vectors, old-time facelift surgery was a skin-only procedure. You removed whatever was redundant, you closed up what you had left, didn't have much longevity, and the way that those faces were being pulled were in directions that nowadays we know are not appropriate. I mean, when we've got these areas in the jowl to address now, we know that that vector needs to be more vertical as opposed to more straight back. Okay. And that's what's going to provide the longevity. It's going to provide a more natural look. People don't gain weight in the jowl area, Randy, but when they start to experience a little hollowing of the cheek and the formation of the jowl, it's because that jowl, soft tissue, used to belong in the cheek.
So it's just gravity that has dropped it.
It's borrowing from Peter to pay Paul, because what's now Peter's used to be Paul's.
So then, logically, why would a surgeon want to pull back rather than up? Was it an easier procedure?
It was lack of attention to where proper relocation needed to take place.
Does it still happen today, by the way?
Absolutely happens today.
Really?
And I think, and it's not just one vector, Randy. I don't want people to leave the show thinking that, you know, everything gets pulled now in some new special direction. You know, the vectors change.
When you say vectors, we're talking about direction of pull.
Direction of pull.
Okay.
You know, we're talking about in this high cheek area, we're talking about one direction of pull. In this lower cheek area, we're talking about a slightly different direction of pull, and in the neck, we're talking yet about another direction. So we've got 3 directions of pull that are all going on to help, again, provide that level of improvement that looks as natural as we can get it.
What about the mid-face, lines around the mouth? That seems to be the first place that's obvious.
These nasolabial lines, Randy, are people's principal target area when they come into the office for this facial rejuvenation procedures. They want to know why they're so deep. I didn't have these when I was a younger woman or a younger man, and they want to know, you know, what we have in the arsenal to help correct it. The first thing that I have to do is I got to get them to backtrack just a little bit, and I have to tell them that, look, certain people have this as a normal anatomic feature of their face, and certain people don't. I say, next time you go to the supermarket, walk down that aisle, look at everybody that passes you. Some people have very deep nasolabial lines, these lines in here.
Okay.
Some people have very soft nasolabial lines, and some people have none at all. So what they have to understand is eradication of those is not consistent with rejuvenation, but softening them is. Because what we experience in the mid-face as we age is a general descent towards the floor.
Okay.
And so in taking this mid-face and putting it back up into a more youthful position, it naturally softens the nasolabial lines. And we have to take it yet a step further.
But what about the guy that says to me, Randy, it's all about fillers? Put fillers in there.
Fillers work to a degree, and again, people can buy...
But some people, you're saying, need that lift.
Some people need a combination of both. Like we talked about in the eyes, people can gain a little bit of time before needing some of those more aggressive procedures by using a little bit of fill volume in that cheek tear trough area.
Okay.
We can do the same, we can apply that same methodology.
When you say buy a little bit of time, you're talking about putting off maybe a facelift.
Surgery, exactly.
Okay.
And we can do that same little buying of time and putting off that surgical management by laying some fillers in here. And under the best of circumstances, it should be a combination of the two. So if somebody is already at that stage where surgical management could be a real boom for them, then putting this mid-face into a little bit of a better position, in addition to softening up the depth of those nasolabial lines with fillers or with their own fat, provides that level of improvement that's soft, natural, and accomplishes what they'd like to leave the office with.
Now, this is one of those things that I think, you know, when people ask me, well, what about fillers? Who should I go to? I think you should go to, logically, and I think anybody would agree with this, go to somebody that does everything, like a plastic surgeon. Right. My views have changed. I'm pretty strict on that. Now we want board-certified people on the program. That you should go to somebody that does fillers and can also tell them, you know, maybe you need a facelift.
Yeah. Well, if you go to somebody that only does fillers, then whether you need it or not, you might end up with a filler.
Okay.
Where if you go to somebody who has fillers in the arsenal and part of the armamentarium for rejuvenation, then it can be discussed when it's appropriate, and it can be, patients can be instructed and educated as to why it might not be in their best effort.
But you are a surgeon. Aren't you thinking facelift for those nasolabial folds over fillers, even though you do both?
You know what?
Isn't that the way you're thinking?
We're always thinking that as surgeons, Randy. You know, if we can't cut it, we can't cure it.
Okay.
But you know what? Time has changed that. And my last 12 years of practice has changed my approach to the aging face. It is, you have to combine what you have in the arsenal. And for some individuals, a more conservative approach is more prudent at one particular time. They may just not be at that point yet where they need the surgical management. That's why having a comprehensive office like the Cosmetic Surgery Institute, where we have the ability for people to get educated about a great comprehensive skincare program and work their way up in a stepwise fashion, go from a great conservative skincare regimen to perhaps getting into fillers and perhaps maybe even Botox, and then getting to their surgical procedures at a time when they perhaps may be more appropriate.
With a full facelift, define the full facelift, and you hear things like mid facelift or just neck lift. What are the differences?
Full facelift really embodies doing something to address the suspension in the face, the neck, and then whether one wishes to address those other things in the face that aren't addressed by a facelift. Because a facelift in and of itself, Randy, doesn't address the brow, doesn't address the upper or lower lid complex. So those additional procedures or adjunctive procedures need to be discussed in addition to facelifting procedures, because there's only three things that a facelift is designed to do. It's designed to re-elevate the mid-face, it's designed to re-elevate and restore the natural lines along the jaw, and it's designed to restore the integrity of the lower neck sling. Those are the only three things that a facelift is designed to do.
When does somebody need a facelift?
It's a great question, and it's a question that people ask when they come into the office for consultation. Am I ready for a facelift? Am I too old? Am I too young? And it's my job, Randy, to get them to prioritize. I really need to know, what is it that they look at in the mirror in the morning that they find less attractive than they did a couple of years ago? If it's something that can be addressed conservatively, then we need to backtrack and address it conservatively. If it's something that is truly suspensory in nature, like looseness in the neck or exposure of the neck muscle compartment with that neck banding, then if they give that to me as their primary means for
what bothers them
the most, then I can take them to those surgical procedures that are going to best address.
So
those
for
issues.
jowls, another place, and I'm hearing more and more as I'm exposed to more surgeons nationwide, that some guys say, Randy, all they need is one of these tightening procedures for the jowls. You don't need a facelift. But these are people that don't do facelifts either. They're telling me this.
I think that, look, facelifting.
What's your response to that statement, though?
I think that they're right and they're wrong. I think facelifting surgery is in and of itself, it's very rare. Let's just say people come to the office, Randy, and they sometimes say, I hate my neck, but I love my face. Not that it happens every day, but it's very rare that somebody's neck is aging so far in advance of the face that we can spend all of our surgical management on the neck.
Just the neck lift or whatever.
So what we have to explain to people is that when you do something to Peter, something always happens to Paul. So it's very rare that you can get away with doing a neck lift without doing some semblance of some improvement and tightening in the low face area. So it's very rare or it's much more commonplace, I should say, that when we do the neck, we're doing something to rejuvenate the face. It may not be as aggressive as a full-blown facelift, but it does have to be addressed to maintain the harmony with what's going on here with what's going on here.
What about incisions? Where do you hide those incisions?
They've changed a lot over time, Randy. I mean, from the old incision that scared everybody to death, that line going down the front of the face where they're worried about being seen at the next cocktail party that they go to our ability to hide the incisions in nooks and crannies. We as plastic surgeons, we can't provide scarless surgery, but what we can do is be very crafty about where we place these incisions. And so what we're doing nowadays is we're following the natural sweep of the ear, going behind this tragus or this bumpy part of the ear, into the ear canal, coming out the notch, and most critically, paying absolute exquisite attention to the lie of the earlobe, so that as the incision comes around the earlobe and up behind the ear and high into the hairline, that this earlobe has a very natural lie after surgery. But one of the dead giveaways of the old facelift surgery was that pixie ear deformity.
But it's still going on, though.
It is still going on.
And by the way, nationwide, would you say half of the surgeons are doing it in front of the ear, half are going inside the ear?
I think more and more are realizing the advantages and people's need to have these incisions as hidden as they can.
Is it more technically demanding?
It is more technically demanding. And I think that the other thing that we have to do is, again, it's not one size fits all. We've got patients that come in that have very short hair. We've got patients that come in that play golf every day and they tuck all their hair up into a cap. And so their primary concerns are, I don't want the people that are playing with me looking at me from the side and seeing these incisions. So what can you do to help me? It's a little bit of a different animal when somebody has a lot of hair as opposed to somebody who has a little bit of hair. And it's quite different between men and women.
Now, a lot of men coming in?
More and more.
Okay. Since you're brand new to the Valley, the new plastic surgeon in town, what do you want people to know about you when it comes to the facelift? Like if they're talking behind your back, what do you want them to say?
I think that if somebody comes to the office, wants a consultation with me, they're going to find somebody that's compassionate. I'm a good listener. I take it my primary responsibility to get a real sense of what you came to see me for. And I find it, I also look at it as my job, Randy, to make sure that I've given patients as comprehensive an education that I can about what we have in the arsenal to help them get where they want to go.
Okay.
So I want them to leave saying, I feel better educated. That guy seems pretty compassionate. He seems like he listened to what I had to say instead of telling me what I needed to hear.
Okay.
And I want him to leave the office, saying, I know 5 of his other patients that have great results, and I want to get the same great result that they left.
So natural-looking facelift.
A natural-looking facelift. Turn back the clock. I look like the same person. I just look like I did 10 years ago.
Great stuff. I want to thank you for coming on the show.
Thank you very much,
Very
Randy,
interesting.
for having me.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.